Another one most important, again, India concerns. India like countries, developing countries. Yes or no? Developed countries, we are unity, come diversity. And geographically, lot of differentiation. That is like mini India now we can able to say. So why I am telling this, because there is a resources. It's the most important. What I want to do in Tamil Nadu or Kerala cannot do in Patna. Yes or no? Because their resources is less in terms of the human resources, doctor resources, and the funding from the state itself. It's a developing state compared within the India different. Within the state itself different. One in city, one in another area, rural, urban areas. Why I am telling? Because resources is the most concern you want to utilize. Example, I use all the patient in the betadine, but you cannot apply everywhere. Sometimes there are cost factors. So resources is the most concern we have to think whether I can able to. Because sometimes you think some literature you study today, I want to do this. Sometimes it's not possible. You have to see feasibility concern. You are not able to do that due to resources. And another role is most important, expertise. I think everyone know that. One of the interventional, mostly radiological intervention. Radiological intervention. It's a very good outcome than any other things. In the radiologist, they do intervention, but at particular time, there is a time that they have the time that within the time the patient, like stroke patient, I'm talking about stroke patient, they reach even the patient with the ischemic stroke patient, reach the hospital within 30 minutes to 1 hour if you diagnose them. The radiological intervention outcome is more better than you go for any other, interventions. Even the patient is recovery, discharge, that is very, very different than the patient is going with any kind of other drugs, thrombolytic or whatever you give. The reason behind it, that is not done by every radiologist. The radiologists who work in AIMS are working because they undergone some fellowship in other countries, they coming and do it. So because everyone who studied in radiology, they do only X-ray or CT and MRI. They may not know everyone to do the interventionals. Only some certain institution, their faculty, they would have undergone some experience or some kind of training they are able to do. So this is happening in AIMS. It cannot possible to happen in other institutions if they want to practice best practice. Even though it's considered as the best practice to save the patient, improve the outcome, but it is not possible or feasible to the other institutions in the state because non-availability of the expertise person. Why I am telling you this? One example I am telling because recently one of the my close relative is passed away due to not intervene very properly. The time they come to know that they asked me, but we cannot sit the patient from Tamil Nadu to AIMS or Tamil Nadu to another places. Even that is a really, most of the time we are the lake up. But in other countries in US, UK, all have the uniformity in the healthcare and uniformity of the people existing in the same kind of expertise in all the area. But India like country, very, very challenging to establish the evidence-based practices. Why I am telling that is going to talk by the next speaker. But still, it's the most important concern because overall my session is to sensitize you what is evidence-based practice. My session is 45 minutes. But with this slide itself give you clarity on that. These three components is the most component. It's the integration of this all component, bring into the evidence-based practice. If there is one component you are not able to, achieve it, you are not able to take up, that is not considered to be the evidence-based practice. Because evidence-based practice overall give the patient satisfaction. Yes or no? And patient improvement of the patient care outcome. So that's why we are considered this. Next one. One with that. This is the core of the EBP. But today you are here. Yesterday you missed the lecture, the first one lecture. I took it that one for half. That means you are going to understand the relevant, valid information through your searching the literature. Yes or no? Actually this lecture on Sunday, same it will be repeated because he had some health issue, is not able to come, he didn't come. So anything connected with the using valid and relevant information. Valid, what is valid information? Yeah, justified. Yeah, you accept it. Yes, this is the truth is exist. Yes or no? You find out as some relevant, depending upon that how robust they done it. Rigorous methodology they followed. And it's appropriately they have done it. Then you can able to take decision. I think this is something valid. It can be taken up. So, and again relevant. Relevant means it can be applied to you what you wanted looking at it. Yes or no? Relevant. I think it's relevant to me, relevant to my practice, relevant to area where I am going to use it. So that relevant and valid is the most core for EB practice. If you understand that being a nurse, because definitely today you are nursing officer, you taken some decision. I want to change that solution, whatever normal saline is betadine or whatever that you want to take. You cannot take immediately decision. Yes or no? You go to the consult with your CNO or the head nurse. Even that they cannot decide. Okay, in Indian scenario, then you got to the medical superintendent. Yes or no? So why? Because so many people are involved take decision making. But again, I'm telling you that decision may be by them, but finally again come to you to use it. Yes or no? So you are the one to report, you are the one to use it. But taken decision by somebody, but still you are the one to report. No, the reporting person always to know exactly what they wanted, which in the context you are going to use it before reporting. That because every time we think about that, evidence-based practices for the not higher level, the person who is going to utilize it. That's why we are sensitizing you all at nurses' point of view. Next one, this is what that ABP is defined. Defined means what I told you, 3 core area: best research evidences, clinical expertise, and the patient values. The values are more important other than what I can say that about the evidences expertise. That concentration of the value only you are able to satisfy the patient. Patient is satisfied. I am very happy. That is the most important that we can able to achieve through this EBP. So here that the definition was using, I already mentioned that the valid, relevant, research-based informations in decision making and integration of these all whatever I told mentioned over there in the expertise and patient values in nursing field. Again, it's like triangle. You go all the you can see that always we see that the gap between theory and practice. Every time we have that, all the time worries. Even I 20 years, 25 years. This is my 25th year. My experience in nursing. I am still looking into the same word I am hearing from when I was student now also. Yes or no? Even if we are teaching the student also, there is a gap, huge gap between curriculum and the practice, theory and the practice. Yes or no? We all the time on administration and the practice. What administrator want, they cannot able to practice. This is the gap, but we cannot able to close it, but still can close it. But how we minimize that the gap is only can be possible. That one of the major strategy to minimize the gap is all theory concept we come to the practice. The all theoretical phenomena or your concept or your evidences, it's come to the practices. That is the only by who will do practice. The practice person to understand all the time which will be the best evidences. That's why this coming like triangle. Your education, you whatever they taught you, whatever understand, make you to think. Oh, why you are leading today? Talk about some literature. You talk about informatics. You think about something. How I can bring it to the practice? How I can utilize into the practice? This is what the question is arise. Same like you are also all the time you have questions, asking questions, Pico questions. That's what you are going to understand today. Evidence-based practice. Some scenarios coming. You asking you in format of thinking in the questions. That is a format you think in your questions. That format only give you the exact answer. Otherwise, you cannot think generally. So that specific questions arise in your mind through your education, through your understanding the concept that education is giving you. Then the research knowledge or methodological knowledge will help you to know which is be rigorous. Which the evidences are really good evidences. Really, we can say give weightage for that, which can be considered as the evidence are very strong, which can be done through the better methodology that can be understood by acquiring and appraising the relevant valid information. I told first one is looking for evidence, looking for literature. The second step you are appraising. Yes or no? You are appraising and acquiring. Acquiring means checking, looking for literature, and again you validate and relevant. You are finalizing which is the valid one, which is the relevant one. That is for acquiring and appraising. So through your research knowledge, scientific knowledge. The third one, you are coming into practice. That's why always the education is giving you the concept. The research knowledge will understand that evidences, understand that your scientific knowledge, which you wanted to use it. The way you understand, we understand the research. Understand the methodology. So understand that how they bring into that, is it be novel? Is it be novel? It's a new. Is it be, rightly can be utilized? Is it be relevant? Is it be valid? That you understand the strength of the research. This, how they have done it. That's a robust. So these all can be known only by the best researcher, or knowing the research, and by the way you understand during the time of your course, during the understand by by the by people will maybe sensitize yourself or sensitize by others. The last one, it is not least, because where you wanted to go, whom is supposed to be utilized, and where you are going to practice, that is the most important component. Yes or no? Yes. That's what the patient, that's what the bedside. So apply and assess. Apply means you practice it, you do it, and see again for assess. Assess means check the, evaluate the outcome. Understand not? You see the outcome, the patient is, wound healing is poor. That is your outcome initially, or delayed, because which type of dressing material used. This is your concept. Again, go to the literature. I can use, burns wound, I can use another one. Yes or no? I can use another kind of methods. Whatever you look into that, you finally decide that you look into the literatures. Maybe in another context they done it in US. Is it possible for in India? Then again look, some of the literature is available in India. Again look into that literature, see that they are done very good way, that the study methodology is good. They use the robust method and rigorous methodology. You decide that it can be possible, then you go for systematic review, meta-analysis. That evidence also show that there is improvising in this, that wound healing. Then you come into the practice, you apply it, then you see that that is improving in this. So this is where usually the evidence-based practices is coming up. But again, even you want to use it, it cannot be possible to do by your own. You have to call your all the disciplinary people, doctors, administrators, and see this kind of dressing, the pack. Is it be able to utilize, are you able to cost factors? You have to see that everybody agree with this. Sometimes consult, no, I don't want to use it. I have used many times. It's not possible. Like this, they give their own comment. You have to give justification for them. You have to, explain to them. They may say that, okay, go for pilot. Pilot means we'll use for 1 month. We'll see that it's able to affordable. Then you see the outcome. You give just again to report it. Then you can go as a standardized practice. What is the difference between conventional with practice you want to change into the newer way, newer technique? And once you achieve the newer technique, you will become standardized. Understand? This is where that evidence-based practices in every area, every places, every context, is making that. So you will become more, happy, and you started to generate the data, and you are able to you can also again to project to the, disseminate to the other people through your publication or your presentation. Yesterday I have shown my all the app. Yes or no? This is becomes now standardized. Now I present to you. You're taking into the information. Oh, I can also do this type of work. This is where evidence-based practices are coming up, and this is to improvise the patient's care, and also it becomes standard. It becomes standard. Standard means it become universal. It's become to practice by everybody, that the benefit of that. It is not only with the localized, not with only one institution. It becomes standardized to everywhere, which is proving that till another methods to come. Another, maybe another after 10 years this become old. The new technique or new practice will come. This is called evidence-based practice, which is improving in different way. So best research evidences that this is because again one triangle that we have different. I will show you later on that can you go back? Because this is the literature. Always look into the different levels, which is the highest level. It is called we can say systematic review. The lowest level is the journal article, which is maybe sometimes we can say unpublished thesis, all the things. So we are, according to the methodology, we are trying to put it's a higher level evidences or lower level evidences. That will be, we can also classify according to the methodologies. So best available research evidences, you can able to classify, because through your research knowledge, your methodological knowledge, if you are not understanding, that's why yesterday I told you, every nurse, either you are diploma, BSc, PhD, okay, the methodology learning is different than you getting your degree. You are getting your degree, you are you are doing, you are conducting, you are innovating, you are doing some work, and reporting and presenting and disseminating, and for that they are giving you a degree or whatever you are giving the PhD. Yes or no? That means the requirement, your partial requirement. In MSc you do some thesis work, and PhD again you take it as a full time. You do kind of research which can be more strengthened, and you are getting into again to the as a thesis you are submitting and getting your degree as a PhD. It's all scholastic work, research work. But it is different than what you are learning methodology. Today you are learning evidence-based practice. Same like you are attending some research classes. Yes or no? By online. You understand the methodology. Doesn't require you go to some classroom or to get some degree and get it. So I expected every nurses to learn methodology and read the literature, read the article. You know how to read, you should understand. Because then only you can able to understand what you are looking for. Yes or no? Example, today I find some problem in the clinicals. I want to know what is the current trend, current management. How, without understanding methodology, you cannot read the article. You may not understand what is methodology, what is the sample size. You may not understand. Sample characters, population, you may not understand. These all languages you may not understand. That's why if you read, you can conduct some research classes for any of the nurses. It is not required any PhD degree. So that way you are able to read the article, you can understand the current evidences that you can add or apply into your practices. So best available research evidence that really to make you to differences. So why I am telling, even today MBBS doctors, they are not having any classes on research in the MBBS. But today BSc program we have research class. I observed that nurses are the best researcher than anyone. It is not reason for only that Nightingale onwards. Again I told, Nightingale not only founder in nursing, she is the founder of healthcare research. Today this is how many people know before coming to this workshop? How many people?
Regarding
Only know Nightingale is the founder of nursing. Anyone know about she is the founder of healthcare research?
yes, sir.
Yeah.
In MSc,
If you are knowing, good. If not, how many of them not knowing before? Why I am telling this? Because sometimes understand your dedication, you are all the time you want to be nurse. But please understand, nurse always have the another goal, another structure. You are the best researcher. Okay? That's why you should know research. And you start to practice which you want to do. Expected to do that in the best manner. That's why we are learning this today topic. Because sometimes I have seen that they told the senior nurses, why we do research? Because I observe, even they used to talk with me. Let them work, let them, do, why you are taking for them classes, why you are, asking them go for MSc. Sometimes they ask, why you have to send for MSc? What is the difference between BSc, MSc? And some of the clinical nurses here, they completed PhD, including her, she is from nursing officer here. My PhD student, full-time PhD. She is nursing officer. Today, we want nurses to be educated. How women are empowered? How women? Only education. Only education empowered. Men, not by country, not by politician. Women themselves empowered only because of education. Nursing empowered only through education. Not any other method. Not any other strategy. So educate more, strong. That is the most important. The education is that understand the literature. Understand not knowing the evidences. Looking forward the new things. That is the one your outcome of the education. Outcome of education is to improvise what you are doing. Maybe the forward is the better manner. So clinical expertise. These are all the clinical expertise. Most important. Why I am telling you, whatever you know the literature, whatever you understand the research, it is not come to the practice, no meaning. Yes or no? Without your clinical skill, without your most important area, your psychomotor domain, your practice, how to do. That is, if you are not knowing. That's why I always expected nurses. All the time we want to be sounded with the skills, not with any other profession after doctors, because doctor also need only to be the skills only the sounded. Even though they take decisions, what is diagnosis, they should not treat. Because of nurses they survive. Even I can able to see some of the doctors cannot do start cannula. Yes or no? Even the patient with the dehydrated children, they come. I have seen some of the pediatricians, they cannot start cannula. They ask, sister, please come. But you are not resisted. The patient, the child may die. But still, nurses are very skillful in do the cannulations. In our NICU nurses. Sometimes some of the physician, I can see they are also very sounded. Then what they do nowadays, bring the ultrasound and start. Do that. Ultrasound guided cannulation. But without ultrasound, many of the children are saved because of nurses. Why I am telling this? Because our core area is the skills. The skills is the core area of the nursing. But we are lacking nowadays. Now our generation is, yes, current generation, they are doing all non-attending. Yes or no? Non-attending means, some of the institution, they are promoting non-attending without going to the colleges, without going to the clinical, without seeing the patient. They are become nurse. So that is only you are able to see all administrator when you see the nurses. You want to only study, you don't want to practice. Why I am telling, without practice, without skills, you cannot consider to be the nurse. But improvising the skills, improvising the practice, improvising the patient care outcome, you need knowledge. Understand both. So both are always interrelated. But basic, very, very core areas of skills. Why I am telling, the skill can be improvised. I used to tell my one of the student, he came for MSc. I don't want to tell the name. He didn't see any patient. He come and join in the aims because of the knowledge, because of rigorous exercise by coaching center. Okay, he got topper in the exams. He come to MSc, he joined. He got even neuro, MSc neuro. Then first day posting, I was there in the clinical. Then he told me, sir, I never see the patient. Then I told, how? No, sir, our institute, we got it like this. And I went through, you're topper. Sir, I know everything. Now also give me a question, I will be number 100 mark I will get. I'm very thorough with knowledge, but I never taken even TPR. I never given injection. I don't want to tell it's at the age level, I'm telling you, because many of the this is all the TNA responsibility. TNA is not only for fighting for, give everything. If you lose everything, we lose everything. I don't want to do cannula. I don't want to practice. I want only salary. I used to tell everywhere, today we celebrate Nurses Day because our senior. Not for Gopi children, not for our younger generation. Please understand. Because still they keep it, still respect for nursing. Yes or no? Yes. So that is only we are celebrating. But still you want to get recognition. We want to get, our profession to be visible. We want to get respect more and get into the, kind of what our doctors are getting. For that only we need better knowledge, better practice and better identity. For that we have to work more. No doubt about it. Still that is our challenges. Because senior was so much, humble. They didn't ask anything. We have to ask everything to get it. But still, we are core area.